Hello, my name is Kat, licensed insurance agent. It was my pleasure to speak to you today regarding Medicare Basic. So for many, Medicare is like a new language. So it started with learning words and putting them together into sentences. Gradually, you become more fluent. At United Healthcare, we try to simplify this process through our Medicare Make Clear program. We hope you will walk away today with a new vocabulary and a clear understanding of what Medicare is and how it works, and most importantly, how it could work for you. So, first of all, the top 10 questions that we will cover are first, we will define what Medicare is and who is eligible for it. Next, we will talk about Medicare if you plan to work past 65. Then we will look at the different Medicare coverage options and cost. After that, we will touch on how to choose coverage and explain the different enrollment periods. Last, we will talk about how you may be able to save money and where you can find more information. So let's talk about what is Medicare. Medicare is health insurance that covers disabled and older Americans. So eligible has to be US citizen and legal residents. It is funded in parts by the taxes you pay while work, so which is the Social Security tax and Medicare tax paid by employee and employers. So remember the pay stub is show FICA tax, that's the parts funded for Medicare. It is an individual's health insurance. So Medicare is not free, so there is some cost to it. It is not a family plan, and it is not a social security, and it is not Medicaid. Sometimes it can be confusing too. So Medicaid is a state government programs that helps pay healthcare costs for individuals, family, and children with limited income and resources. Programs are varies from state to state, but to follow federal guidelines and benefits. Eligibility varies from state to state. And you can also have Medicaid and Medicare. They can also work together. It's called dual eligibility. So we said that Medicare is individuals' insurance, but who can get it? As you might guess, there are eligibility requirements for Medicare. First, Medicare is for U.S. citizens and for legal residents live in the U.S. for at least the previous 5 years. You must also meet one of the following requirements. Be age 65, younger than 65 with a qualified disability, and have received disability benefits for 24 months, or any age with diagnosis of end-stage renal disease or ALS. Each individual enrolled in Medicare gets a card with a unique number on it. Numbers are randomly generated and assigned, so you can see what the Medicare card look like here. So it is a red, white, and blue. As we mentioned, the terms dual eligibility. Now we will dive in a little bit more. People with dual eligibility can have both Medicare and Medicaid. And yes, the two programs can work together. If you are both Medicare and Medicaid, the two will work together and may cover most all of your healthcare costs. Additionally, dual benefits individuals may be eligible for special private Medicare plans. For example, people with Medicare and Medicaid can get special coordinated care plan called dual special needs plan. So the next question is, do I need Medicare if I plan to work past 65? That some of you may be in this situation. So let's dive into different scenario. So if you plan to work past 65 and your Medicare decision may be different, in fact, You may be able to delay Medicare enrollments together. This is generally an option for people who work for an employer with 20 or more employees, and you have employer health coverage plan that is considered credible by Medicare. Specifically, your plan's prescription drug coverage must be as good as or better than Medicare Part D. People who have health insurance from employer with fewer than 20 employees must enroll at age 65, or they could face late enrollment penalties. But what about if your health insurance is through your spouse? Well, in this case, you may be able to delay or you may still need to enroll at 65, even if your spouse employer has 20 or more employees. This is because employers can have their own set of rules for cover dependents. Some employers require cover dependents for Medicare age 65 to enroll in Medicare in order to remain covered by the employer plan. So you can ask the employer's benefits administrator to learn about your options in this situation. Getting Medicare while still working. There are some important things to know about getting Medicare when you are still working. First off, Medicare and your employer insurance can work together. Medicare will typically be the secondary to your employer insurance until you leave your employer or lose the employer insurance. Whichever happens first, then Medicare will become primary. Second, if you take any parts of Medicare, you will no longer be able to contribute to health saving account. Think carefully about this. If you are eligible to delay Medicare enrollment and are going to keep working, Medicare Part A may seem like a great idea to go ahead and get even if you keep working because for most people it's premium free. But if you want to keep contributing to your HSA, it may not be a right fit. Finally, Medicare will not cover your spouse or children. If you decide to take Medicare and also opt to drop your employer coverage, you will want to talk to your employer's benefits administrator to understand what options they might offer for spouse or children. For example, some employers may offer COBRA. Make sure you know what dropping your employer coverage for Medicare only means for your family. What does Medicare cover? So we will go ahead and switch gear to talk about what's original Medicare Part A and B. So there are two parts. Part A is the hospital insurance, which helps to pay for hospital and inpatient care. Part B is the medical insurance, which helps to pay for doctor and outpatient care. So Part A hospital insurance covers services provided during an inpatient hospital stay. Most covered services are listed here. This includes your room, your meal, and your nursing and other services. One important thing, you may notice something missing the list of doctor services. This is because doctor services are covered by Part B, even when you are in the hospital. Another thing to point out is that if you want TV or phone in your room, you may have to pay for those. Part A doesn't cover this item. It also doesn't cover custodian care, which is care that helps you with daily life activities, such as eating and bathing. So here are some additional important facts about Part A. Part A has premium, but few people pay for it. Remember the FICA payroll tax? If you and your spouse pay for 10 or more years, you get Part A premium free. You can't deny Part A coverage, regardless of your health or financial status, and you are covered at any hospital in the country that accepts Medicare. Finally, you need to know a few terms to understand Medicare Part A benefits. Part A coverage and costs are based on benefits periods. Benefits periods begins the day you are admitted to the hospital and ends after you have been out 60 days in a row. Observation status is another important term. Part A cover hospital stay when you are admitted as a patient by doctors, not if you are there for observation, even you stay overnight. Part B will pay for some of this cost. Lifetime reserve days. Those are extra coverage hospital days that you can draw from you if you are staying at the hospital longer than 90 days. The maximum length of stay covered in a benefits period. You get 60 lifetime reserve days. Each can only be used once, but gift day can be applied to different benefits period. We will come back to this term in a bit and talk about the cost. So now let's look at Part B medical insurance. The main cover services are listed here, so which include doctor visits, the tests or exam your doctor might order, and other outpatient services. Also, we just discussed, Part B covers doctor services when you are in the hospital as well. There are a couple things to point out. First, an annual Medicare's wellness visit is an opportunity to meet with your doctor to discuss your health status and goals, things that our regular visits may not provide time for. Is covered 100% with no copay as long as you stick to its purpose. If the discussion veers into current health problems like cough, for example, or if you receive additional service that are not part of the visits, like lab tests, procedures, or certain other services, then there may be cost. It's good to know this ahead of time to prevent any surprises. The second thing to point out is that medical equipment is covered as well, DME. To be covered, the equipment needs to be medical necessary and to prescribed by doctor. It also needs to come from a supplier approval by Medicare. So in most cases, you can't just buy a walker and somewhere and have Medicare pay for it. Talk to your doctor first. Here are some last facts about Medicare Part B. Part B has monthly premium. If you are receiving Social Security or Railroad Retirement Board benefits, the amounts will be deducted from the check each month. Again, we will talk more about the cost in just a minute. Just as with Part A, you can't be denied by Part B coverage regardless of your health and financial situation. And you may see any provider in the country that accepts Medicare. Finally, Part B charges a premium penalty for late enrollment unless you qualify for special enrollment period. We will cover enrollment period later in the presentation, but some people, including those work past 65, may delay Part B enrollments without penalty. And to many people's surprise, Medicare doesn't cover everything. Original Medicare Part A and B does not cover all of the costs of your care. You have out-of-pocket costs, which no limit, which is not financial stable and could cause a lot of stress for many people. It doesn't cover prescription drugs, does not cover routine dental, vision, and hearing care, doesn't cover eyeglasses, contacts, or hearing aids, does not cover long-term or custodian care, so help bathing, eating, dressing, doesn't cover excessive charge for service by doctor who don't accept Medicare assignment. It doesn't cover care received outside the US except for certain special circumstances. So where can I get more coverage? So even from these simple examples, you can see that original Medicare doesn't cover everything, and that out-of-pocket costs for healthcare items and services could add up and take a bite out of your budget. The good news is that you have options for other coverage that can cover other things like prescription drug, and that can help you turn that budget bite into a nibble. On the notes, we are now talking about the Medicare Part C and D and supplement insurance cover and how they can work for you when you decide what Medicare coverage to choose. So you have two options for more coverage. Option one, what you can do is to add a Medicare supplement insurance and Part D prescription drug to original Medicare. So how it works is that Medigap will cover the out-of-pocket expenses that Medicare Part A and B doesn't cover, and Part D will cover for your prescription drug. Options 2 is you choose a Medicare Advantage plan, Part C, and most Medicare Advantage plans include drug coverage, Part D, and other additional benefits such as routine dental care and vision services. So before we dive into these options, I want to point out that all three of these components show Medicare supplement insurance, Medicare Advantage plan, and Part D plans are offered by private insurance companies. What this means is that part is there may be a number of plans to choose from, and they might vary in coverage and cost. By contrast, original Medicare is administered by the federal government, and benefits and costs are same for everyone. Medicare Advantage and Part D plans are approved by Medicare and held to standards set by Medicare. These private plan options are provided to give you more choices and the ability to fill in of what doesn't cover by original Medicare. We will circle back to this graph later. For now, let's continue through the alphabets and talk about Medicare Advantage, otherwise known as Part C. So it is an alternative to original Medicare. It is contract directly with Medicare. So it is a private insurance. So plan members are still in Medicare program, which means you still pay for your Part B premium. And the plans are offered by private insurance company and is specific by the county, state, county, and city. So most plans are offered to build in prescription drug coverage. And plans may also include additional benefits such as dental, vision, and fitness. So by law, Medicare Advantage plans must provide all the benefits that original Medicare does. So plans combine Part A and B coverage in one package. One exception is hospice care, which covered by Part A even when you have Medicare Advantage plan. Most Medicare Advantage plan also includes built-in prescription drug coverage, or Part D, which we will talk about next. Finally, Medicare Advantage plans may also offer additional benefits, including coverage for dental, vision, or hearing care, as well as fitness program. The result is an all-in-one plan similar to what you may be used to have when you have it through an employer. There are many different types of Medicare Advantage plans. Most are coordinated care plans, where care is delivered through a provider network. You may get care outside of the network, but you may have to pay more, or even the full cost. Most coordinated care plans are HMO or PPO plan. HMO plans have networks of doctors, hospital, and other care providers to use to receive cover services. POS plan are type of HMO plan that also lets you to go see outside of the network. PPO plans have providers network you can use, but also offer more freedoms to see provider outside of the network for all the cover services. Special needs plans are designed specifically for people with certain healthcare needs. The dual special needs plan we talked about earlier is a kind of special needs plan specifically for those who have both Medicare and Medicaid coverage. There are also chronic special needs plans as well, cater for people that have chronic conditions such as diabetes. Institutions special needs plan is for people living in skilled nurse facility. An institutional equivalent special needs plan is for people living in the community and need the same kind of care as those who live in skilled nursing facility. Private fee-for-service plans typically offer more flexibility in choosing provider than other types of plans do. In general, you can get care from any Medicare approval providers who accept Medicare. And here are some fast facts for Medicare Advantage. So you must still be enrolled in Part A, Medicare Part A and B, and live in service area. Can be denied coverage based on current financial and health status, including pre-existing conditions. May be required to use provider and pharmacy networks. Coverage and costs vary by plan and may change each year. An annual limit on out-of-pocket costs for Medicare covered services. Current limit is $9,350 and may charge a monthly plan premium. Must continue to pay Part B premiums to Medicare. Now let's move on to Part D, prescription drug coverage. An easy way to remember is Part D. D stands for drug. So there are two ways you can get the prescription drug plan. One is through a separate standalone Part D plan. Two, or through a Medicare Advantage plan we just discussed. Standalone Part D can work with original Medicare, Medicare supplement coverage, and select Medicare Advantage plan, for example, private fee-for-service plan and medical savings accounts plan, MSA, without drug coverage. And like Medicare Advantage plans, Part D plans are offered by private insurance company. Each Part D plan or Medicare Advantage plans that include drug coverage create a list of specific drugs that will be covered. The list is called formulary. Each plan has its own list of covered drugs, but every plan must cover a range of both generic and brand name drugs that are generally needed by people on Medicare. Plans also cover all commercially available vaccine, like the shingle shots that aren't covered by Part B. Part B covers things like flu or ammonia shots. So Part D has different tiers in the formulary, which is a list of prescriptions covered by a plan. So for example, tier 1 and 2 usually is the lower cost medication such as generic, and then as we go higher the tier, it is more expensive such as the brand name drug or specialty medications. So Part D has a range of coverage and it is by stages. So the beginning stage is the annual deductible. So if your plans has an annual deductible, you will have to pay those deductible down first before the plan pay. And then moving on will be the initial coverage. So the initial coverage, as long as you or some other plan, for example, will be the prescription plan, cover the total $2,000, then you will be able to get out of the initial coverage. So that will move you to the catastrophic coverage. Once you hit the catastrophic coverage, you will not need to pay anything out of pocket. So these are the fast facts. Prescription drug, as long as you enrolled in Part A or B or both, you will qualify. So some of the plan you will require to use in-network pharmacy. Coverage and cost vary by plan. It may even change every year. Part D premium penalty for late enrollment unless you qualify for special enrollment period. Now let's talk about Medicare supplements insurance, also known as Medicare. Medicare supplements insurance, which are also offered by private insurance company, are different from the plans we have discussed so far. As the name say, they supplement Medicare. So they are not Medicare plans and in and for by themselves. Medicare supplements insurance plans help to pay some of the out-of-pocket costs that come with Medicare, like deductible and co-insurance. They can only be used with original Medicare, not with Medicare Advantage. Plans are standardized by federal governments. There are 10 plans labeled with letters. For example, Plan A. Every plan of the same letter provides the same benefits no matter what insurance companies offers it. Massachusetts, Minnesota, Wisconsin are exceptions to the rule as these states standardize their plans differently. It's also important to know that Plan C and Plan F are only available to individuals who are eligible to Part A or turn 65 before January 1st, 2020. Here are some of the costs that Medicare supplements plan may help with and some that may not. You will see that they help pay for coverage already provided by original Medicare and may extend in some cases. As with extra hospital days, Medigap plans can help with Part A deductibles and costs and foreign travel emergency. Here are some of the costs that Medicare supplements plans may help with and some may not. You will see that they help pay with coverage already covered by original Medicare and may extend it in some cases with extra hospital stay. Medigap plans can help with Part A deductibles, original Medicare's copay, co-insurance and provider excessive charges, cost of blood transfusions, and cost of foreign travel emergency. Additionally, some programs may cover Part B deductible costs, but only for those individuals who were eligible for Part A or turned 65 before January 1st, 2020. But except for foreign travel emergency coverage, Medigap plans don't fill in what Medicare doesn't cover, such as prescription drug or dental and vision care. Some plan providers may offer value-added services for free or discounts basis, but they are not part of the Medigap plans directly. Here is the chart. You can see the overview of the 10 Medigap plan and what they cover. So we have Plan A, B, D, G, K, L, M, N, C, F. So for example, for Plan L, the plan that it shows the 100% Part A for the hospital stay. So as you can see, some plans, they cover certain items and some plans are not. So it's important to go ahead, take a detail, look at it to see which one is the most optimal for you. So Medicare supplements fast facts must be enrolled in both Medicare Part A and B and live in the states where the plan is offered. No medical underwriting up to 6 months after enroll in Part B at age of 65 or older. Nationwide coverage and no provide network. Guarantee renewable as long as you pay your premium. Plan premiums may vary for same coverage. So what that means, for example, if you have a friend who has Plan F and live in a different state, different area, the premiums you both pay could be different. Plans with more coverage generally have higher premiums. You must continue to pay Part B premiums to Medicare. So how much does Medicare cost? Most people are familiar with premium, deductible, and copay, but not so quite sure about co-insurance. So co-insurance is the amounts you pay when the plan splits the cost and cover service with you by percentage, such as 80% and 20%. What that means is that the plan will pay 80% and you will pay the remaining 20%. Now let's look at the comparison between Part C, D, and Medigap costs. So Medicare Advantage Part C usually has low or no monthly premium. It might have deductible, it has copay and coinsurance. If you have Part C plan, you will also have to pay for the monthly premium for Medicare Part B. For Part D prescription drug, it usually has monthly premium, it has deductible, copay, and coinsurance. And for Medicare supplements insurance, it has monthly premium, it has deductible, copay, and coinsurance. However, many of the Medicare supplements insurance do have a cap, so which will protect you for financial crisis. So all these plans you do need to keep in mind. Besides that, you will have to pay the Part B premium. So how do I choose? As you can see on this chart, there are 7 combinations you can choose from, which is 7 options. So let's go ahead cover each one of them. What you can do is to just stay with the original Medicare Part A and B, or you can get Part D to get the prescription drug. Or you can do Medicare AB and add a Medigap supplements plan. Or you can do all 4, Part A, B, get the drug plan, Part D, and add the Medigap supplements. Or what you can do is to just get the Medicare Advantage plan all in one, which already include Part C and D. In a very few options, there's some Medicare Advantage plan let you also purchase Part D separately, but remember to read the plan carefully. Now let's look at it closely. Step 1. What you will need to do is to enroll in original Medicare. Get the red, white, and blue card, including Part A and B. Step 2. Find your options. Your option 1 is to get a drug plan, or also get the Medicare supplements plan and drug plan together. Options 2 is the Medicare Advantage plan. Remember, Medicare Advantage plan is an alternative to the original Medicare. So that's already include the Part C and D. Should I choose Medigap or Medicare Advantage? So there are some considerations. Medigap will pay for whatever original Medicare doesn't cover. It does not include drug cost. It is a nationwide coverage. It may offer additional benefits as an add value services. The cost. It has monthly plan premium. Also, for the drug Part D plan, it has the drug premium. It has some out-of-pocket costs, really depends on which plan you choose. The convenience. So it has multiple plans when added with original Medicare along with Part D plan. Now let's look at Medicare Advantage. So it provides benefits of original Medicare and beyond. It may cover additional health benefits, for example, dental, vision, hearing. It has provider network. The cost. It may charge plan premium, so you may want to check if there's any plan premium or low premium. It's often no additional premium for drug coverage because it's already included. It might have copay and co-insurance for most of the covered services. It has the annual out-of-pocket maximum. So the convenience is all in one plan. Let's think about this choice in terms of coverage, cost, and convenience. Coverage. Provider choice is one of the main considerations between these coverage options. Medicare supplements insurance help pay for cares from providers nationwide. Medicare Advantage plans generally have provider networks, and each service is set geographic area. Another key consideration is what you need coverage for. Do you want coverage for prescription drug, dental, and vision? Questions to ask. Am I able to get most of my health care needs near home? Am I willing to change doctors if mine isn't in the plan network? Do I want coverage for additional healthcare service like dental, vision, hearing, or fitness? Cost. Both options help manage costs, but in a very different way. With Medicare plan, you may pay higher premium than Medicare Advantage plan, but other costs may be lower. With Medicare Advantage plan, you pay copays, but the premium may be lower, and you are protected by the out-of-pocket maximum. Question to ask. How often do I use healthcare services? Would I rather pay higher premium even when I don't use the service? Or would I rather pay copays when I use the service? What level of Medicare supplements insurance can I afford? Convenience. Many people opt for Medicare plans, also pay for Part D plan. With original Medicare, that's three different plans. With Medicare Advantage, it's usually just one. Question to ask. Which coverage options is the best fit for my lifestyle? Do I feel about working with multiple plans together, or do I just want to stick with one like Medicare Advantage? Whether you choose Medicare supplements insurance or Medicare Advantage, be sure to consider your needs and budgets and compare which one is the most optimal for you before you make the decision. When can I enroll? For most people, they enroll Medicares when they turn 65. That's called initial enrollment periods. Total has 7 months. 3 months before you turn 65, on the month that you turn 65, and 3 months after. If your birthdays is on the 1st, then your enrollment period begins and ends 1 month earlier. If you qualify for Medicare due to disability, then your initial enrollment period includes your 25th month of receiving the benefits, the 3 months before and 3 months after. You are enrolled in Medicare Part A and B automatically if you are receiving Social Security or Railroad retirement benefits at age 65. You will get Medicare card in the mail. Otherwise, you will need to sign up yourself online, on the phone, or visit your local Social Security office. During your initial enrollment period, you can also enroll in additional coverage, for example, Medicare Part C and D. Remember, those plans you need to enroll with private insurance company. Final note, you may refuse or delay Part B enrollment and take just premium-free Part A. This may be a good idea for people who have employer plan or other credible coverage. Some employers require you to take full benefits, Part A and B, at age 65. You may also want to join Medicare Advantage plan or Part D plan during your IEP if you are eligible. Ensure if you have decided to delay that doing so won't mean you have to pay any late enrollment penalties later on. It is important to pay attention to the timing of your enrollment to avoid late penalty. We will talk more about it in a minute. So the general enrollment period is the initial enrollment periods may enroll in Part A, B, or both. So usually happen in January until March. This is the general enrollment period. Medicare supplements open enrollment is it lasts 6 months beginning with the month in which you are 65 or older and enrolled in Medicare Part A and B. No medical underwriting if you enroll during this time. You may apply at other time, but you could be denied coverage or charge a higher premium based on your health history. Working past 65. For those who delay enrollment with credible employer coverage, you have 8 months to enroll Part A, B, or both. You will have first 2 months to enroll in Medicare Advantage or Part D prescription drug. You have exactly 63 days to get a standalone Part D plan or Medicare Advantage plan with prescription drug coverage without penalty. We have mentioned penalties a number of times, so let's go over what the penalties are. Medicare Part A, none if qualify for premium free. The penalty is 10% off the Part A premium. Medicare Part B, none if qualify for a special enrollment period. The penalty is 10% of the monthly Part B premium amounts for each of the full 12-month periods enrollment is delayed. Part D, none, give less than 63 days without credible coverage. The penalty is an additional 1% coverage average Part D premium for each month you delay enrollment. So it's important to pay attention to the dates so you don't get penalized. When can I change my coverage? You can change your coverage choices if you decided to during Medicare annual enrollment, which is October 15 to December 7th every year. The new coverage will go into effective on January 1st. We will not go deeply into what changes you can make. The message is the Medicare provides this annual enrollment opportunity so you can keep your coverage up to date with your life and needs. Open enrollment period. This open enrollment period is specifically for Medicare Advantage Plan members and runs from January to March 31st. You must be a member of Medicare Advantage Plan on January 1st to be eligible in the enrollment period. During this time, you can switch to different Medicare Advantage plan or go back to the original Medicare. Enrolled in a standalone Part D prescription plan, give returning to original Medicare. Just one coverage change allowed. Unless you qualify for a special enrollment period. What is special enrollment periods? Is qualified life events. For example, moving, living retiree, union, or COBRA coverage. Medicare offers special enrollment period for qualified events. In most cases, you have 2 months from the date of qualified events to make coverage changes. During special enrollment period, you may join, switch, or drop Medicare Advantage Part C or prescription drug plan Part D. However, there may be some restrictions depending on how you qualify for special enrollment period. Again, we won't go into too much about it. The main point is that Medicare provides for times when you might have to change your coverage outside the usual for an annual enrollment period. We have talked about Medicare's coverage options. Now let's talk about how you can save money. One way to help you save money is to do your best to live a healthy lifestyle and take care of your health. Medicare's cover a range of preventative services, many of them at no cost to you. Learn what they are and take advantage of them. You may also be able to save money by choosing your providers from within your plan network if you have one. If not, make sure your provider accepts Medicare assignments and won't charge you beyond what Medicare will allow. And then there are drug costs, which are concerns for many people. Ask your doctors or pharmacists about ways to save. You may be able to switch to generic or other lower tier prescriptions and get better price by using different pharmacy. And always, and you are in the hospital, ask whether you are inpatient or are there for observation. It makes a difference in how your care is covered, and many may have impacts in your cost. If you need it and qualify, you may able to get help by paying some Medicare cost. There are many programs shown here. It is worth asking about them. Even if you think you won't qualify, a good place to start is with your state's Health Insurance Assistance Program, SHIP office. You can find a number at shiphelp.org or by calling Medicare at the number shown. Where can I get more help? Medicare Made Clear. Visit medicaremadeclear.com. Sign up for our newsletter. View more Medicare topics article brought to you by Medicare Made Clears on unitedhealthcare.com/news articles/Medicare/articles. View more Medicare's topics and articles brought to you by Medicare Made Clears on uhc.com/news articles/Medicare's articles. More sources. Visit medicare.gov. Call 1-800-MEDICARES. Contact your local Medicare or state's Medicaid office. Thank you.